So I'm really delighted to be able to talk to you about this topic today, along with my colleagues as well. What do we mean when we talk about brain health? Well, according to the World Health Organization, it's a state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. Quite a mouthful, maybe more than you had thought when you came in. And as you're probably aware, the world's population is aging, and there are increasing numbers of people living older and more healthy lives. Every single country in the world is experiencing a growth in the proportion of older people in their populations. And by 2030, which is just in a few years' time, 1 in 6 people in the world will be over the age of 60. By 2050, that will have doubled to 1 in 3. And by 2050, the number of people over the age of 80 will have tripled. So as the population ages like this, there's more and more interest in the idea of living as healthily as possible. And central to this is brain health. And this is a global health priority. And it's hardly surprising, as well as the aging population, we currently have about a third of the world's population is currently suffering from some kind of brain or neurological disease, which is a very, very high disease burden. So what can be done about this? Well, there's a number of initiatives, both globally and more regionally, aiming to promote the idea of brain health and address the burden of neurological disease, such as the one from the World Health Organization. This one is from the European Association of Neurology, called One Brain, One Life, One Approach. And it's focusing on brain health as being something we need to preserve, protect and prevent and plan around. There's also initiatives from just down the road from us here, the Global Brain Health Institute in Trinity, in collaboration with UCSF. And a particularly important one that we're going to speak about today is the report from the Lancet Commission on Dementia Prevention, Intervention and Care. So this is an international group of experts, again, coming together and summarising all of the scientific evidence in relation to brain health and dementia prevention. They've written a number of reports, and the most recent was just out this year in July 2024. And they've identified 14 modifiable factors across physical, mental health and lifestyle, which can reduce the risk of dementia and promote brain health by 45%, which is really quite marked. And the message is that it's never too early to start thinking about brain health. The sooner in your lifespan you think about this, the better. So there's something for all of us to take from this. The longer you try and address this, the better. But the really important good news is that it's also never too late to think about doing things and making changes to promote brain health in your own lives. So I'm going to talk to you about some of the factors identified in that report, and then my colleagues are going to speak to you about some other ones as well. So if you take a look at this infographic, this is from the report, and I'm not sure if you can see that clearly, but the green circle at the top is highlighting a factor from early life. The yellow circle in the middle talks about factors at midlife, and the blue circle at the bottom talks about factors from later life. And I'm going to talk you through a number of those. So first of all, I'm going to talk about the one in early life, which is around education. And essentially, it's there's a clear link between levels of educational attainment and brain health. So the higher the levels of education attainment, this is a protective factor for brain health. And what we've seen is that where countries have increased their level of educational attainment across the population, the kind of prevalence and incidence of dementia goes down for that very reason. Now, because the population is aging, you see more case numbers occurring, but actually the prevalence and incidence is going down. Now, you might sort of think, well, look, I'm at an age where, my schooling is over, et cetera, et cetera. But in fact, it doesn't just end at the school days. So there's also a clear link with occupational complexity. So the more complex and demanding your job, the more it's linked with brain health. And this also has a protective factor. But it doesn't end there either, okay? And this is really, really important because, in fact, engaging in cognitive stimulation activities has a positive effect, even if level of education has been low. So even though that's a modifiable factor, it's not all over, because we can be doing things today and at any time in our lives to engage in cognitively stimulating activities. And it's because of the brain's ability to be plastic. So there used to be a view that you were sort of born with your brain and it was hardwired in a certain way and it was unchangeable across the lifespan. But we know that's absolutely not the case now. So the brain has the capacity to change and grow, build new connections, develop new nerve cells at any stage in the lifespan, even into later life. And there's lots been written about this. And Ian Robertson who's our colleague down in the Global Brain Health Institute down the road, and he's going to be coming in and speaking to us a little bit later in the week. He's kind of conceptualizes this as sort of 3 key principles of challenge, change, and learn. And he says these are the recipes for a healthy brain. So he's written about this in his book, Stay Sharp at the Mind Doctor. And there's also another book there just to highlight by Sabina Brennan, who's also part of the Global Brain Health Initiative. She's also written about this idea of kind of use it or lose it. So I'm going to talk to you a little bit more about the change, challenge, and learn concepts. So in terms of change doesn't have to be something very dramatic or scary or kind of cost us a lot. Change may just be changing minor things in our way of life. But the key thing is that you change something in a way that forces you to have to pay attention more than you are now. So we tend to often live our lives in a slightly kind of mindless way, in a routine or an automatic pilot. But when we change something or we introduce novelty, it kind of switches on our attentional systems. When we do this, it stimulates more brain areas than when we're doing things in a routine way. So it activates brain-enriching neuromodulators, which are the chemicals that help strengthen the connections between brain cells. And suddenly our brains are being plastic and growing more cells and connections. So here are some sort of suggestions of the kinds of things you might think about. It could be simply changing something about your lunchtime routine, acting on a whim in some way, talking to someone new. I'm sure all of those things have happened for you today already, so you're already activating your brains in helpful ways. Could be changing something about your physical activity, changing something about your appearance, decided to get a different kind of hairstyle, and so on. So they don't have to be dramatic or drastic changes. They can be small things. So let's look at challenge, because this is a little bit more of a bigger deal. So Ian Robertson says challenging ourselves is different from changing, because this is where we decide to take on something that's a little bit difficult for us, where we may sort of doubt at the beginning that we're quite up to achieving it. And it creates a kind of a benign form of stress that actually increases the levels of the chemical noradrenaline in our brains. This has been called the wake-up drug. And it's a brain messenger, and the levels of it can kind of deplete a little bit over our life course. But noradrenaline boosts the rate at which connections form between brain cells at the synapses, which are the kind of end point of brain cells. Now, we know from a brain health point of view, too much stress is a problem and creates different kinds of issues. But this kind of moderate type of challenge is actually really good for our brain health. So, for example, me standing in front of you today, doing this talk, I had to figure out some new features in PowerPoint. They were all challenging experiences. So doing this is really, really good for my brain. So thank you for giving me this opportunity, okay? So the kinds of things that you might think about, oh, could I challenge myself with this, would be things like Would I take on some new kind of work? Maybe it's something at home, it might be something voluntary, maybe it's paid work. Maybe I'm going to travel to some place I haven't been before, or travel in a different way than I have done before. Maybe it's about developing a new interest, again, trying some different kind of physical activity, or doing something different in your social life. And the possibilities are endless. These are just examples. And then to think about the area of learning. So we know learning kind of boosts growth of connections in the brain, and this is why the kind of early learning years of attainment are protective for brain health. And they increase brain health by 7%. They reduce the risk of dementia by 7%. But just because the first few decades of our lives, tend to be defined by our educational experiences, there's no reason why that can't also be the case later in life. And in our later decades, maybe during a period of retirement, but this time may be fueled more by a desire for knowledge, interest, pleasure, rather than by necessity, as it would have been in our earlier lives. And we know this directly leads to plasticity in the brain. There was a fascinating study done by an Irish neuroscientist called Professor Eleanor Maguire back a couple of decades ago now, where she studied the brains of London taxi drivers. So London taxi drivers, actually I don't know if they use Google Maps now, but they certainly used to have to do quite an arduous exam about recognising streets in London. And I mean, you've seen the A to Z to London, it's quite a tome. And she studied the brains of taxi drivers, in particular the hippocampus, which is an area of the brain that's associated with learning and memory. And what she found was that compared to non-taxi drivers, the posterior hippocampi, so the back part of the hippocampus, was much bigger in London taxi drivers than in non-London taxi drivers. And it simply showed a couple of things. One is that that's an area that's key for sort of geographical navigation in the brain, but also very much that principle of use it or lose it. And the taxi drivers were using that part of their brain so much, they actually made it grow bigger, just as you would if you're working out a muscle in the gym. It gets bigger and bulkier, and that's literally what was happening to their brains. So when we think about learning, we're trying to make our brains denser and richer, and here are some suggestions of the kind of things we might think about. It could be learning a new skill, like learning a musical instrument, or learning to speak a new language. Lots of people are getting into Duolingo now. It's very easy to access. It could be doing a formal course, signing up to something in a university or in a community college. It could be picking an area of interest that we have and deciding to pursue our own path of knowledge in it through the libraries and so on. So I'm going to leave cognitive stimulation behind now, but I hope I've managed to convince you of its value. And I'm going to talk about some of the other factors that were in that Lancet report. So I'm going to talk now about hearing loss. And again, this is something in midlife, but it's not confined to midlife because we can address this at any time. So again, there's a very clear line of evidence pointing to a significant association between hearing loss and the subsequent development of dementia. But not just that, but that also having hearing tests done, wearing hearing aids and hearing devices lowers the risk of dementia. So in studies where there's a higher proportion of people wearing hearing aids, there's a lower proportion of people who go on to develop dementia. And even for groups of people who are already experiencing some cognitive impairment, again, the use of hearing aids was beneficial for brain health. And there's lots of reasons for this, but ultimately the key message here is to address hearing issues. And the evidence does point out that, the more severe the hearing loss, the greater the impact on brain health. The longer the duration of hearing loss, the greater the impact on brain health. So the earlier we can recognize this and intervene on it, the better. Specsavers should be paying me some money here, but they're not. And the other thing I'm going to talk to you about is visual loss. So we've known about the hearing loss issue for quite a long time, but there's actually quite new evidence about visual loss also being a risk factor for dementia, but if we address it, it's protective for our brain health. And again, the message is that there might be a number of different reasons why somebody might experience visual loss or visual impairment. It could be because of macular degeneration or diabetic retinopathy, cataracts, and so on. But again, there's clear evidence showing that the greater the visual loss, the greater the association with developing dementia. And intervening using things like cataract surgery or even just glasses increases brain health. And the Lancet report points out that, treatment of visual loss is generally pretty clinically acceptable. None of us, I see lots of people here wearing glasses. I have my own set here. We don't seem to worry too much about wearing glasses, and they're often reasonably cost effective as well. So it's a simple intervention that we can engage in. I'm going to hand you over to my colleague, Dr. Declan Lyons.
It's great to see everybody here today, and delighted you all turned up on such a climatically challenging day, so well done. I want to expand on what Karen has said and drill into a bit of medical data. I'm talking about cultivating an ageless mind. It's hard to have an ageless brain, every organ ages, but maybe we can have an ageless mind, and also living longer and healthier. So are we living longer or healthier, or both, hopefully? I think we have all noticed that in society there's a massive demographic shift and dramatic increase in life expectancy over the last 2 centuries, coinciding with the Industrial Revolution, more than doubling from an average life expectancy globally now from 30 years to 73 years by 2017. Now in Ireland, obviously, we're nearly at the 83 mark for life expectancy, so we're ahead of that. But these are global figures. Economists will still say, though, that the proportion of people's lives spent in poor or moderate health in old age has not changed, according to the McKinsey Health Institute. There's a bit of debate about that, but there's no doubt that dementia cases will almost triple by 2050, although it's not a globally negative story. We have evidence to show that actually the incidence is falling in some developed countries. Certainly reducing dementia risk is, if you'll pardon the pun, very crude no-brainer. It increases health span and reduces duration of ill health in those who develop it. In other words, even if you do develop it, hopefully in late old age, you will have the condition. It will not be the cause of our mortality. Now, midlifers will all know about brain health. If you ask them, have you a healthy brain? They'll say yes. When I beat my brain fog, or when I overcame my fatigue, or day-to-day forgetfulness, or anxiety, or stress, to strive and stay focused and keep up with a very, very hectic, multitasking, busy world that we all live in. But I'm talking about, suppose, specifically for later life. And as Karen said, we now know that we can prevent or delay dementia by addressing several risk factors that account for 40% of dementia worldwide. So this has been known about for some time, but I think it's now being put out really as a very important public health message. So prevention of dementia is possible. That's the first thing to say. By really looking at these compounded risk factors, not just looking at one thing in isolation. That won't make much of a difference, unfortunately. But when we adopt these positive health behaviours and manage important medical conditions together, then we can make a difference. And there is evidence that there's a decline in dementia and Alzheimer's. And when we talk about dementia, I'm talking about all-cause dementia, and there's lots of different causes of dementia. But a 40% decline, notably in South Korea over 12 years, that's not bad. That's pretty impressive. And it's been put down to largely improvements in vascular health. That's one factor. Obviously, education is another factor as well. And the benefit of that is obviously, better quality of life for everybody, carers and family members included, and less strain on the health services, because all components of the health service that we work in will struggle to effectively manage and treat dementia. Good brain health, though, is more than just about dodging the dementia bullet. I think it's also about increased happiness and increased life satisfaction, optimal functioning and social participation, maintaining optimism and harnessing the wisdom and perspective of later years. Later life does give us a fantastic dividend. We mustn't squander it. We have to actively harness it and utilise it for ourselves. So in essence, it's down to minding the heart. Minding the heart minds the brain. And keeping an eye on blood pressure is one thing we should mention. And the research says aim for a systolic blood pressure of 130 millimeters of mercury or lower from around the age of 40. Now, I don't think we should get too hung up on this because blood pressure is very variable according to what time of day it's taken, and most GPs will acknowledge that a single blood pressure reading is just that, it's a snapshot. Lowering LDL cholesterol, we'll talk a little bit about that, limiting alcohol to 1 drink a day and ceasing smoking, following a heart healthy diet and maintaining a healthy weight. Obviously, a well-rounded diet of fruits, vegetables and healthy unsaturated fats, the Mediterranean diet, mitigates the risk of obesity and all the things that come in its wake, including hypertension, high blood pressure, high cholesterol and diabetes. And all of these things singly and collectively contribute to dementia burden and the likelihood of developing it. Obviously, these preventive lifestyle measures are inherently attractive. I'm being honest in saying that, look, in over 20 years, it's not exactly that we've much to announce publicly in terms of drug developments or disease-modifying treatments. I'm an optimist, though. I do think science will ultimately bring some benefits. But the huge expectation of September 2023 with the lecanemab study, unfortunately, we know that these treatments are quite cumbersome and have significant side effects. But I hope they will be overcome, and I hope Big Pharma, and it does get castigated a lot, but I do hope it maintains its focus and interest in this area. But preventive lifestyle measures are low cost, no side effects obviously, and have positive effects on quality of life. So cholesterol, what do we need to know about that? HDL basically takes cholesterol to the liver for release, while LDL, or low density lipoprotein, brings it to the arteries where it forms plaques, along with triglycerides, and that obviously narrows vessels, impairing blood supply to key organs, and we're all aware of the effects of this on the heart, but also the brain. So what are the guidelines? Aim for a total of no more than 5 millimoles per litre of total cholesterol. LDL should be no more than 3, and that's the important one, by the way, your LDL. That's what's come out of this Lancet Commission update. And triglycerides no more than 2. Now, cardiologists can sometimes, and GPs, be quite discerning as to who they will give a statin or cholesterol lowering medication to and who they won't. And very often they look at family history of heart disease. That's a big factor in their deliberations. But obviously maintaining a healthy weight treats high cholesterol and lowers the risk of diabetes. So we're back to that. Smoking in midlife has been found to be a strong risk factor for developing dementia. And again, back to midlife, it's about diabetes prevention. That's also important because the brain has insulin receptors too, and neuroinflammation and amyloid deposition in the brain can be increased through the mechanism of type 2 diabetes. Is it all about midlife? Is your attention to your health in midlife critical here? And it is important, midlife is important, but we've heard that early education is important. Certainly obesity in midlife is a risk factor for dementia, and again this vicious circle effect. In those who don't exercise, they're more vulnerable to elevated blood pressure, more vulnerable to high cholesterol and type 2 diabetes. Interestingly, the Lancet Commission also picked out air pollution and emphasises the importance of reduction in exposure there as a preventative measure. Exercise at any age, though, no matter what age, not just in midlife, that can be helpful for cognition through improving brain blood flow, particularly in the front part of the brain, the frontal lobes, enhancing brain plasticity and reducing neuroinflammation. Prevention of head injury at all ages is crucial to avoid brain injury, and that can be sometimes a trigger for dementia. We will see this sometimes in our memory clinic. So, there's really no excuse not to use a helmet when you're cycling, and obviously contact sports and so on. Alcohol consumption, that's important for all age groups, particularly in terms of accident prevention, health awareness and medication interactions. And treating depression is an important factor in later life in maintaining cognitive health, and we'll talk about that a little bit later. Now, blood pressure is complex, and we often look at people coming into our memory clinic on big regimes of antihypertensives for decades, but the science seems to say that controlling high blood pressure and midlife hypertension, if it's not controlled, increases the risk for all types of dementia. But interestingly, blood pressure may decrease at time of diagnosis of dementia. Sometimes your physical weight can decrease. So over vigorous treatment of high blood pressure can cause problems as well. It can provoke dizziness, cerebral hypoperfusion, falls risk, and even cognitive decline, worryingly. But very high blood pressure should be controlled even in later life to reduce stroke risk. Overall, the Lancet Commission will say that taking blood pressure medications, often long-term, often from midlife, appears to lower dementia risk. But it's not clear which agents within the category of antihypertensives are most beneficial. We know prolonged anaesthesia can lower blood pressure, and that can be sometimes a risk too. So the message is, I think, have your blood pressure medications reviewed by your GP. The link between depression and dementia is interesting, and it goes both ways. It's bidirectional. In the years before a dementia diagnosis, depression can be a symptom of evolving dementia. It could be a reaction, you could say, a very understandable reaction to cognitive decline, or even be a cause of cognitive impairment. So the Lancet Commission will say that depression in midlife can also be considered a risk factor for dementia in later years. And within that cohort of untreated people with depression, those at greatest risk will be those with less than 8 years of education. And the good news is that treating depression does seem to reduce the risk of dementia. And that's very reassuring, I think, particularly for us in our business in this hospital. And interestingly, medication and psychotherapy have additive beneficial effects in combination for risk reduction of dementia. So I couldn't do a talk on brain health without mentioning longevity. And obviously, if we have a brain that is healthier for longer, hopefully we will have the longevity to put it to good use. So what are the insights that you've all heard about on the wonderful Netflix series Blue Zones? Has anyone looked at that? It's an absolutely wonderful series by a journalist who's maintained a decades-long interest in this area. Really, really good presenter, and quite drills down and is prepared to go and talk to people in communities, do on-field research. So Dan Butner's insights would be around not smoking, would be about staying physically active, keeping socially engaged, cherishing family, eat a plant-based diet. The Sardinians that he met talked about eating whole grains and fava beans. The Okinawans talked about avoiding time urgency. Wouldn't that be wonderful? And be purposeful. And the Seventh-day Adventists talked about faith and keeping the Sabbath. But Dan Butner issues a really salutary warning when he talks about the next generation of Americans could live shorter lives, not due to, opiate use in America, but due to childhood obesity, which is very, very worrying. The exact opposite in terms of what we're talking about childhood education. So, in summary, the physical health headlines: get recommended health screenings, manage chronic problems, discuss existing prescription with your prescriber, and ask your GP, does this prescription have effects on memory, sleep and brain function? As Karen says, treat age-related sensory conditions, the hearing and visual loss, reduce risk for falls. That is a major, major important act to do to preserve our physical and mental health in later life. These falls could lead to brain injuries or catastrophic life-changing physical injuries. And we all know people who've had hip fractures and so on. Limit use of alcohol. Sorry about that. The party is over, guys. Quit smoking. Be mindful of diet. Nutritionally dense foods, low fat, high fibre. Get enough sleep, 6 to 8 hours. The mental health headlines I've deliberately put in red. What actually overlaps with physical health is that isn't evidence of body-brain interaction. I don't know what is. So the mental health headlines would be mental stimulation, get physical exercise, improve our diets, improve our blood pressure, blood sugar, cholesterol for mental health. Low-dose aspirin, some controversy about that. Is there ultra-low-dose aspirin? I suspect the dose could go even lower, not just the 75 milligrams a day that we're all prescribed. Avoid tobacco, don't abuse alcohol, care for your emotions, protect your head and build social networks. Find meaning in life. Maintain high-level goals and mini-goals along the way. Get a good night's sleep. Hone in on gratitude. Maintain and build confidence through patterns of positive self-talk. And obviously, as Ian Robertson has eloquently expressed, embrace change and challenge. So actually the prescription for an ageing brain I know I've burst the party bubble, but it's actually quite pleasant. It gives pleasure and zest to life. The top 3 for all ages, assuming that you don't have any medical conditions, then would be good sleep. It may reduce dementia risk, in the Dion Monday study in 2016, and the relative risk of sleep disturbance of 4 hours or less is 1.53 in terms of increased risk of dementia. Move your body, and the guidelines are 2.5 hours per week of brisk walking. Brisk walking reduces levels of depression and is very beneficial, particularly for the frontal lobes of the brain. Clean up your diet. Remember, food turns into neurotransmitters, so think about that the next time we stuff a Big Mac into ourselves. I wouldn't like to be on Donald Trump's election team diet. I'd say it wasn't too healthy. And this junk can influence our immune system and endocrine systems. But the top message, perhaps of all, top of the list for older people, I'm going to give a direct quote from the Lancet update in 2024. Prioritise age-friendly and supportive community environments, housing, and reduce social isolation by facilitating participation in activities and living with others. That seems a simple, broad statement, but embedded within that is a lot of societal challenges. I'm going to hand over to Owen now.
To start, it can be worthwhile to recap on the role of occupational therapy. And as occupational therapists, our core philosophy and belief is in the therapeutic use of occupation, with the term occupation referring to any activity that gives personal meaning and fulfillment of valued roles. Examples can include gardening, walking, even doing household chores. It can also be the nuts and bolts of daily life, getting up, dressed, and having breakfast. We know that the occupations we engage in can encourage our wellness within moderation, but it also has the potential to cause us distress if taken too far. For example, work. Conversely, we also understand the impact a lack of routine and occupational engagement has on our mental health, our well-being, and indeed our brain health. Occupational therapists, we like to categorize things. So we also categorize occupations into 3 domains. The first one of which is self-care. So these are occupations we do to look after ourselves both physically and mentally, what we do to recharge the batteries. So this could be washing, eating, making sure we sleep well, talking to a loved one, exercising. It could also be going to the hairdresser every week. Productive occupations are those occupations that give a tangible result or allow us to fulfill a productive role. Examples here could include work, paying the bills, and household chores. Leisure then refers to those occupations that we freely engage in for enjoyment in our free time. Examples here could be baking, gardening, walking, going on holidays. As occupational therapists, we believe in a concept called lifestyle balance. So having a sufficient blend of self-care, productive, and leisure occupations that ultimately allow us to maintain wellness. It's a bit too simplistic to say if we spend a third of our day doing something self-care, a third of our day doing something productive, a third of our day doing something leisure, we'll experience balance. The truth is, lifestyle balance is unique to all of us. What works for one person will only work for that person. It is important to note the impact of the environment and all the occupations we like to do. So that includes the physical environment, the social environment, and of course the cultural environment. From a brain health, and indeed a quality of life perspective, we know the importance of social connection in maintaining good mental health, satisfaction, and ultimately living longer, healthy lives. Maslow theorized a sense of affection and loving connection to others as an essential human need. The concept of loneliness is linked to, but it differs from socialization, because it's about people's feelings that their social contact is inadequate. A definition of being socially isolated is defined as meeting at least 2 of 3 criteria. The first one is living alone, seeing family or friends less than once a month, and participating in no weekly group activities. However, just because an individual may meet the criteria for being socially isolated, that does not necessarily mean that they may feel lonely. Not all people who live alone may feel lonely. We have all experienced the concept of loneliness. From a statistics perspective, from Tilda, Almost 1/3 of adults aged 50 in Ireland experience emotional loneliness at least some of the time. And participants aged 75 years and older were more likely than younger participants to report being moderately lonely. Social contact in any form has a potential beneficial effect on dementia risk by building our cognitive reserve, by promoting healthy behaviours and reducing stress. These benefits also translate to positive effects on our mood and our physical health. Tackling social isolation is quite complex and ultimately requires a tiered approach and interventions at numerous levels. Interventions at the level of the individual to tackle socialization and loneliness could be delivered one-to-one or in groups. It could involve befriending services or social prescribing, which is a relatively new approach by the HSE in which individuals are linked in with meaningful activities within their community. At community and society levels, lack of resources, inadequate transportation, or in some cases no transportation, can lead to social isolation. The environment in our communities can either help or inhibit social connection. And ultimately, as Dr. Lyons was saying, we need more age-friendly environments. The design of housing, living with other peoples, ensuring shops, restaurants, and local activities are accessible and inclusive to all our needs. Physical activity has many benefits, and it can benefit our brain health in numerous ways. First, due to its ability to promote cardiovascular health. What's good for the heart is good for the brain. Physical activity helps improve the blood flow to our brain. It reduces inflammation, and it can help lower our levels of stress hormone. Exercise can also provide physical health benefit to our brain also. It can increase the thickness of our cerebral cortex and improve the integrity of our white matter. And it can also promote neuroplasticity, which is the brain's ability to form new neural connections. In other words, your ability to learn throughout your life. A lifetime of regular exercise is best for optimal brain health, but it is never too late to start. Even for an individual who might be quite sedentary, starting exercise can have a beneficial impact on their mood and their overall health benefits. Anybody at any age can get the benefits from adding exercise into their life. We often think as well, particularly when we're considering implementing more physical activity and exercise into our routine, that it needs to be intensive. It very much does not. A randomized control study looked at exercise among 50% males and 50% females over the age of 78, and they were assigned to 3 groups. One 5-year control group, which the recommended daily exercise limits were reached, one moderate intensity continuous training group, and one high intensity training group. After 5 years, there is no significant difference in cognition. So the emphasis here in doing as much as we can, that every little bit of activity we can do is beneficial. As a whole, physical exercise has many benefits for our physical and mental health. It helps control our weight in tandem with a good diet. It helps prevent and manage many health conditions. And overall, it contributes to our overall sense of well-being. Global recommendations regarding exercise is about 30 minutes a day of moderate intensive activity, 5 days a week, or 150 minutes a week. Moderate intensity activities are those that get our heart rate pumping, so about 50 to 60% higher than its rate at rest, and I suppose you still should be able to talk. As human beings, we're creatures of habit, and implementing changes into our routine can be exhausting, and at times overwhelming, because it requires a conscious effort on our part. Habits take time to form, and there is a need for consistency even when our motivation wanes. A few tips to make it that little less daunting is to make it meaningful. If we like whatever physical activity, we are far more inclined to keep it up because it's motivating and will likely require less effort to implement into our routines. We also do need to start small with regards to physical activity, and this very much ties in with pacing. We need to listen to our bodies and engage within the context of our current capabilities. Oftentimes, we can have a tendency to go all out and start at a level that we aren't able to sustain, and that can sometimes lead to us abandoning our efforts. The importance of realistic goal setting comes in here too, making sure it's not easy, but it isn't too difficult either. With every step you take on that walk, every mile you pedal on that bike, or every lap you swim in that pool, you're enhancing your cognitive fitness and brain health. From an occupational therapy perspective, to improve both our social connection and physical activity, we very much advocate for engagement in meaningful occupations or activity. We're all unique, and we all have varied interest. This slide shows the interest checklist. It's an assessment tool that's often used by occupational therapists to ascertain potential meaningful activities individuals may wish to engage in for their routines. Just because we only did a certain hobby in the past, that doesn't mean we couldn't do it again with a little bit of help or modification. It can take time and conscious effort to build habits and alter our routine. And by engaging in occupations we like doing or have an interest in, it can make those habits to implement that little bit easier. I'd like to take a few moments just to talk about useful resources within our community from a social connection and physical activity point of view. First one is the Men's Shed. It's a community-based project where men can come together to learn, share skills, and make long-lasting friendships. First founded in Australia in the 1980s and has since expanded to other countries, including Ireland, the UK, America, and Canada. Interestingly, Ireland has become one of the leading nations for men's sheds in recent years, with Ireland having the most sheds per capita. All sheds are independent and self-autonomous, and the range of activities carried out by sheds differ. Some of them may include woodworking, gardening, carpentry, and community work. However, there are ones with more special interests that include things like music and fishing. Again, men's sheds are more than just woodwork or gardening. They are places where men can find meaning and purpose. Another very good, useful resource is Active Retirement Ireland. It's a voluntary organisation for older people with a national membership of around 25,000 people and over 550 local associations. As an organisation, Active Retirement Ireland believes that all older people are equal and they're entitled to be treated with respect. And all older people have different interests and needs, which Active Retirement Ireland aims to meet. All the activities are aimed at keeping older people active and well, and active retirement associations are a lifeline for many older people who would otherwise feel isolated and lonely. Another useful initiative is Get Ireland Walking, a recent initiative by the government, but it aims to provide local walking groups within all localities within our community. It is tailored to older individuals, and there are many walking groups available throughout the country. This final slide shows a list of very useful resources from both a social connection and a physical exercise point of view. Our good colleagues, Friends of the Elderly, and the Trojan work they do in combating social isolation amongst older adults, Social Prescribing Ireland, and Get Ireland Walking. Fit for Life is a local exercise-based group based in Sandyford, and they have been doing exercise classes since 2001 for older adults and tailored to them. They also have online options available from anyone attending throughout the country. Our local library is often one that gets missed. There are many opportunities within our community that we may not be aware about, but our local library will likely know. A loan befriending service, another essential lifeline for older adults. Age Action and its advocacy, in addition to its care and repair service. And the Irish Countrywomen's Association. Finally, it's also about using the resources at our disposal, utilising the free travel pass if we are entitled to it, and ensuring that we have a quality of life that allows us to engage in all the activities we like doing that are valuable to us and meaningful to us will go a long way in improving brain health. Thank you so much.